Hello, my favorite community. How everybody else is doing? Comment below. Let me know. I am, if you're not familiar yet, Dr. Z, a clinical psychologist specializing in transgender care. Welcome to my channel. If you're not yet a subscriber, please go ahead and do subscribe. This way, you will not only be supporting me, but helping everybody else find this valuable content that is completely free. And if you also don't follow me yet on Instagram, link is below. Trust me, it is worth it. I post fantastic short educational tips and guidance reels, as well as additional advice and support. It's a great way to connect with me on Instagram because I'm there daily. Having said that, I wrote down a little cheat sheet here before this. I wanted to say before the session, but before this video. What we're going to cover today is I'm going to give you 4 signs for red flags to look out for when you are working with somebody who claims to be a gender therapist or gender specialist, LGBTQ knowledgeable, you name it. And I want you to be aware of these red flags because therapy is not cheap. Most insurances don't cover psychotherapy. And if they do, not everybody takes insurance. Your time is valuable. Time is something that we can't get back. Once it's spent, it is gone. On top of that, for all of you, I know struggling with uncertainty, lack of clarity, debilitating fears and anxiety, all revolving around gender dysphoria or revolving around some sense of gender identity or issues related to gender identity. I know how important it is for you to get answers to your most pressing concerns. I know how valuable it is for you to not waste any more time. And I know for those of you who've been living with dysphoria for decades, I know how vital it is, again, not to waste a single day because you are so ready to move forward. So I want to give you these 4 flags so that when you do spot them with somebody who claims to be gender therapist or gender specialist, again, you name it, but somebody who basically says, hey, I know what the heck I'm talking about, you can then make a choice, make a decision whether you want to stay with them or whether you can actually go ahead and seek somebody else. Now, when it comes to psychotherapy, without a doubt, it's still an exchange of service. I know that we are in a very unusual relationship with our clients because it is so personal, it is so vulnerable, it is so deep. At the same time, it's nonetheless still a service exchange. People pay me for 50 minutes of my time, and I pay back in value. And the values that I bring is trying to aim to give people as much clarity, as much guidance as possible. So it's still an exchange. I'm bringing this up because I want you to know that in the end of the day, you are a consumer. In the end of the day, it is your money, your dollars token, whether you're paying out of pocket or whether you're paying with insurance. That insurance either you bought for yourself or you have it provided by company, but you still have to work for. So I want you to remind yourself that you are in an assertive position of a consumer. You can at any time in therapy decide to leave. You can fire your therapist. In fact, if your therapist has all these 4 flags and they are really misrepresenting themselves as a gender therapist, I would highly encourage for you to fire them because in my opinion, you would just waste not only money, but your time. Now, having said that, I also know and realize that finding a gender specialist, specifically somebody as deeply specialized in gender issues and especially gender dysphoria as I am, is incredibly difficult. I can count on my fingers how many psychologists I personally know who solely, and I mean solely, focus on gender dysphoria the way that I do. And that's very, very unfortunate. Having said that, it doesn't mean that you can't find a therapist that, apart from focusing on other issues, also has somewhat remotely good experience working with gender diverse individuals. That is more possible than finding a gender specialist. Now, will that individual be as deeply knowledgeable as, for example, I am? Probably not. And that's okay. I don't want you to stress out to feel like gender specialist is somebody who is absolutely deeply knowledgeable, and yes, they should be, right? But if you don't have access to them and you only have access to somebody who is much more, I would say, generalized in a way, but still is benefiting you because they do have somewhat good relevant experience, that's also very valuable. In the end of the day, what's really important is whether you find that the therapist you're working with is helping you. The 4 flags that I will be discussing are primarily aimed at helping you to steer away when you are in therapy and you're paying money, you're spending your time, and you're scratching your head and you're wondering, why am I not further along? Why are things not working out? Why haven't I got referral for A, B, or C? Why is this taking so long for them to figure things out about me? If you're in that position, if you see any of those 4 flags, then you're working with somebody who is really misrepresenting themselves. And today we have a lot of those people because people jump on the bandwagon of being gender therapists. It's like everybody today is LGBTQ friendly. In my opinion, we all should be LGBTQ friendly. That just means being a mindful human being. So, what are those 4 flags that I want you to watch out for? Last thing I want to mention is if you are working with therapists and they meet those 4 flags, but they have been very transparent with you from the get go that you're my first client, I really don't know much about it, and you really like working with them, you please do continue work with them because if they're being that transparent and you already know what you're stepping into and you make the decision based on that knowledge, that's also valuable things to keep in mind. Red flag number 1. Red flag number 1 is you go to their website, and today I can't imagine mental health provider not to have some form of web representation, right? So you go to their website, and on their website, they just have one single mention: LGBTQ friendly, or work with transgender individuals, or work with, gender dysphoria, and they have nothing else. Nothing else. The whole website, maybe they're blogging about depression or anxiety, but they have nothing else mentioned about gender dysphoria, transgender folks, non-binary folks, and yet they claim to be gender therapists or gender specialists. You go to any other social media presence. You go to their Instagram if they have one. You go to their Facebook if they have one. You go to the LinkedIn account if they have one. And again, there's serious, it's crickets, right? Other than that one mention, it's crickets. Other than putting rainbow flag on their website, it is crickets. And yet they are there telling you that they are knowledgeable. This is a big red flag. All you have to do is take a look at my website. From the get-go, you can see that the only thing I do are work with trans and non-binary adults, and I'm very skilled at gender dysphoria. Why? Because there is a ton of blog posts on the issue. There's a ton of videos. There's a ton of content. I have programs designed all around this topic. Nowhere else is it mentioned that I work with any other issues, period. Now, that's obviously an exception. You're looking at somebody who is very specialized, right? And I don't expect your gender therapist to be that special, but she should have something to showcase that they know what they're talking about. And their social media presence is going to be the first step. So that's number 1. No media presence whatsoever, other than little rainbow flag here, little trans flag here. In my opinion, that is just not enough. Red flag number 2. When you sit down with them, you can tell they have a very dogmatic, archaic, old approach. What is dogmatic, archaic, old approach? It's an approach that dates back to 1,000 years. Well, really not, but I feel like it's 1,000 years ago. It's an approach when trans individuals, in order to get access to care, had to have a narrative, had to stick to a narrative, particular narrative that was so severe in order to get permission for gender affirming care. And that narrative was something along the lines of, I really hate my body parts. I think 24/7 about getting myself rid of those body parts. I feel trapped in a wrong body. I have severe dysphoria. It's borderline very extreme. Some things that we know a lot of people today don't feel, and some still do, but a lot of people, the dysphoria is going to range. And for some of you, it's going to be pretty mild. For some of you, it's going to be severe on some days, for some of you on all days. But that old, archaic, dogmatic narrative Now, you can tell that a clinician or a provider is not knowledgeable when they stick to it. Why? Because that means that they probably got a training or read a book that is published again 1,000 years ago that discusses this type of approach, that discusses other areas of dogmatic approaches, such as you have to evaluate a patient for a long period of time, 6 months to a year, to conclude they have gender dysphoria. What the heck? Who has 6 months to a year? That's 6 months to a year for you to suffer with gender dysphoria, while that provider who is not knowledgeable has to jump through the hoops and jump through their own anxiety about whatever it is they're anxious about in order to conclude that something is that somebody who is remotely knowledgeable should come to conclusion relatively quickly, unless you have a very complicated case. Even then should be no more than 3 months. That's for very complicated case. For everybody else, it should be several sessions, 2 to 3, to make that conclusion. Assessment of gender dysphoria should not take that long. It takes me a single session for most individuals, 2 maybe to 3 sessions for the rest. It's really not that challenging once you know and had at least remotely some experience with gender dysphoria. So if they're saying they need to see you 6 to 12 months just to derive a diagnosis of gender dysphoria, that's an archaic, dogmatic way of doing. And that means that they don't know what the heck they're looking for. So they're buying time for themselves in order to figure things out. And that's not all right. In my opinion, that is not only incredibly negligent, but it is just, it's really brutal and, pardon my French, fucked up, because it puts a client in a position of enduring suffering at expense of a therapist's ignorance and lack of experience. So that's how, that's number 2, is you're seeing those type of dogmatic approaches to treatment. Another form of dogmatic approach that are archaic toward treatment is going to be when they tell you things such as, I want you to present for 12 months in your desired gender until, I can refer you for hormones, which, by the way, you don't even need a referral for hormones in pretty much every single state these days. So keep that in mind. And in those states where you may need a referral, you can still get hormones without referral online through a lot of online gender clinics. So if they're putting you to jump through these hoops, which are unreasonable, nobody is going to suddenly present in their gender. I mean, most people are not going to, without at least going through already some changes in hormones and feeling more confident, because you're putting yourself out there. That means your potential risk of being misgendered is increased. That means your risk of being traumatized by our messed up culture is also being increased. It's unsafe. It's incredibly unsafe in a lot of states, and it's just not way to approach the treatment. So that's another indication that they're dealing with dogmatic, archaic approach. Red flag number 3, you have to educate them. You bring up a vocabulary. You say, for example, at one point I felt like NB was something that resonated with me, and they look at you completely blank, blinking their eyes, trying to figure out how quickly session can end so they can Google NB, and you can tell they don't know what the heck you're talking about. When you bring up desire for any kind of gender affirming care, gender affirming surgeries, they don't know what the heck you're talking about. When you bring up that you're considering between peritoneal pull-through vaginoplasty, or you're considering between, for example, penile inversion, they don't know the difference. When you bring up that you already had vaginoplasty and you're struggling with vaginal stenosis, they don't know what the heck you're talking about. That's a red flag. When you have to sit there and you're talking about your context, your life, and they don't even know basic knowledge about what kind of care is out there, what kind of vocabulary out there, even a very rudimentary language in regards to variety of gender identities out there. That's another red flag. I had somebody who came to work with me, and they said, and this has killed me. They said that at one point they shared a particular book with their therapist because their therapist was lacking knowledge. And there was one session they had when therapist was reading out of the book to the client. This is wildly messed up and wildly inappropriate. We are trained to be competent in our fields, and we're ethically prohibited by practicing outside of our competency. Every therapist for licensure had to learn this. It was drilled into our heads that if you have zero experience, if you're the only provider in geographic area and you have a patient with gender dysphoria, for example, and you have zero experience, yes, you can treat the patient, but you have to tell them you have zero experience and you have to seek consultation and guidance and support outside of your competency with somebody else who has that experience. If you are, especially in a state where there's other people who are competent and you're not competent, but you're marketing yourself as such, that's a big no-no. So when you have to educate your therapist, that's an indication that they lack competence. That's red flag number 3. Final red flag number 4. It comes a time when you need one of those still required evaluation letters in order to get insurance approval, or maybe your surgeon wants it, even though you're paying out of pocket, to get gender affirming surgery. And all of a sudden, your so-called gender therapist has no idea how to do it, how to write one, and they refer you out to somebody else. Like myself, maybe I had people come to me and they say, "Oh yeah, my gender therapist referred me to you so that you can evaluate me for my gender affirming surgery coming up." And I look at them thinking, "Your gender therapist referred you to me for a letter they should know how to write. It is 101 basics." That's another big red flag number 4. They should not only know how to do that, that should be part of your treatment plan. That should be part of the services they provide. I also have a pet peeve when you're already paying a therapist for their time and then they charge you additional money to write you that letter. Because to be honest, it's not like they're doing additional assessment. It's just a letter. It's not much. And they shouldn't charge you money, in my opinion. I mean, this is kind of like controversial opinion. Every therapist has a right to set their own value, to decide what they do. In my opinion, that's just why. It's a single one-pager letter. I have a template for that letter. You put in information, you put in certain characteristics after working with client for some time because you already know they qualify, and that is it. It doesn't take much of my time. So that's another red flag number 4. So these are 4 very important red flags to watch out for, especially if you're working with somebody that does in fact market themselves as a gender therapist or gender specialist, and they have one or is they have all of these 4 flags. If you have an option to go and work with somebody else, please do so. Even if you have an option to go and work with somebody else who is not knowledgeable at all, but is transparent with you about that, that honesty is their willingness to work with you. It's their willingness to at least perhaps even reach out to somebody and consult and learn versus somebody who is masquerading behind a label, but they can't deliver and they're wasting your time and they're wasting your money. So remember those 4 red flags. Number 1, they have no online or media representation whatsoever. Number 2, they're using the dogmatic old 1,000-year-old approach. Number 3, you're sitting there educating them, teaching them. And number 4, they don't know how to write your gender affirming evaluation letter. Comment below if you had experience seeing somebody who claims to be a gender therapist or a specialist and you were deeply disappointed. What was it like for you? What was the telling sign? It really sucks when it does happen. It shouldn't happen. I also understand the reality of life is every profession has bad apples, but I really wish it didn't have to have bad apples, especially when it comes to mental health, something that is so important to all of us and something that a lot of us take at a big value for ourselves. So comment below, share what your experience has been, and I will see you all next time. Goodbye.